I'm Dr. David Hill, and today we're going to talk about how to give breathing treatments to children with asthma. Now, asthma is a disease of the airways. It is a type of an allergy, and it causes the small airways of the lung to contract to make extra mucus, and that impedes air movement. There are two classes of medications in general that we use to help children with asthma. One are rescue medications. These are in the class called beta agonists, and they're really versions of epinephrine, norepinephrine. They're chemical relatives of these. These are the fight or flight chemicals, and one of the things that these chemical relatives do is to open up the airways temporarily. The two most common are albuterol and levalbuterol, also known as Xopenex. The other class of medications that we use prominently in asthma are medicines that calm down the immune system. They reduce the allergic inflammation inside the lungs. These are all variations on corticosteroids. The most common are budesonide and fluticasone, although there are quite a few others. Those are Pulmicort and Flovent, respectively. So, you got a couple of ways to get these medicines into the child. Number one is a nebulizer machine. This is a machine that makes a fine mist out of liquid medication. The best way to do this is to have a face mask directly over the child's face while you're giving it. Now, some of these come with little pipes that sort of let the mist out. You can try holding it close to the face, but we know that those pipes don't get as much medicine in the child's lung as the face mask. Unfortunately, some children will get really agitated when this is happening, and you're going to have to fight them. It usually takes about 5 minutes to get the medication in. The good news is, if they're screaming, they're breathing deeply, so you know the medicine is going in. Now, the other way to get medicine into these children is a meter-dose inhaler. This is a small canister, usually shaped like an L, that has a little propellant, and it gives a specific dose of the medication out the end of the canister. We know that these medicines are better delivered when you use a clear tube called a spacer. It's usually about the size and shape of a paper towel or a toilet paper roll, and in fact, in an emergency, if you don't have a spacer, you can put a toilet paper roll up to the child's mouth and put the meter dose inhaler on the other side and puff it through there. It does the same thing as a formal spacer does. It allows the medicine to spread out a little bit. When you do that, more medicine goes into the lungs and less gets trapped on the mucous membranes of the mouth. And that means more medicine gets to where it actually works. A lot of spacers will come with a face mask that fits on the spacer because a child usually needs to be about 5 or 6 years old to adequately wrap his lips around the end of the spacer and take a good breath in. But if you put a mask over the child's face, within a few breaths, the medicine is going to go into the child's lungs and do its job. Now, you want to talk to your doctor, no matter which way you're giving the medicine, about which one to give when. Doctors should be giving you a written asthma action plan. It should have a section that says when your child is wheezing or coughing or having trouble breathing, here's the medicine that you give for that. And another section that says here are the medicine or medicines that you give your child every day, twice a day or once a day, to prevent the disease from happening in the first place. So if you haven't been given a written plan, do ask your doctor to provide you with written instructions, because it's really easy to get confused about these medications. Talking about how to give asthma medications to children, I'm Dr. David Hill.